think accountability is an essential function of any healthy organization. The best businesses in the world have a culture of accountability where people do what they say they're going to do. And sadly, I find it very lacking in dental offices, often because dentists aren't really managers and they feel uncomfortable holding their team members accountable. It feels like a conflict to them. But what I find is that when we can get dental teams sort of over that hump of discomfort with the idea of accountability, they're able to advance in a way that they never were before that. And what I mean is they can go to a CE and take that idea back and actually be able to implement it. They can have a meeting about something that they want to change as a group and actually watch it happen. And I think that a lot of dental offices become really stagnant or really stuck in terms of like hitting a ceiling and staying where they are and sort of staying the exact same way for a really long time. And sadly, I think that's often really frustrating for high-performing team members, and they tend to leave. And doctors lose the best people because they want a doctor who will hold people accountable, who will have conviction behind what they say they want. And so it puts teams in a really unhealthy, really stuck place when that's missing from their culture. There's a few simple tools put in place that really help to build the framework of accountability. Of course, there comes a lot of soft skills with management and that type of thing. But really, in terms of tools, the first step is to become really clear about your expectations with your team. So from everything to what their position means to what your values are. A lot of doctors think that they have been clear with their team, but once there's a sort of a clarification meeting of what the doctor really is setting out to accomplish, what's really important to them, it's often eye-opening for team members, even that have been there for a long time. And then I think there have to be some measures of how we're doing. So, taking a look at some basic KPIs or metrics or measurables, whatever you like to call them in your practice, taking a look at those numbers more frequently and learning to talk about how things are going as a team. Oftentimes what I see in terms of how teams are using numbers or metrics in their office is that they're sort of reviewing them after a month is over. So like the 7th, 8th, 9th, 10th of a month, they'll meet to look back on the previous month, and then they'll say, well, the month is over and it wasn't very good. And there's very little that can be done about it. Sort of shifting to a proactive use of numbers, where maybe you're looking at a handful of key driver numbers every week so that you can course correct and build action plans together, is a really culture-changing dynamic. The other thing that I think really needs to be in place are 90-day goals. I'm a big fan of a system called the Entrepreneurial Operating System, where we call those rocks. But a 90-day goal, a sort of quarterly goal for any team, is a really motivating structure to have in place. Instead of saying things that we wish were better, or we'd like kind of like our daily production to be this, and if it's not, oh well. Setting numbers that we're actually measuring against and tracking towards is a really powerful shift in accountability and team dynamics.